You're now tuned into the Lady Charmaine Live Show, and I'm your host, Lady Charmaine. And as always, I got another great interview for you today. And I'll tell you who it is coming up right after this. My guest today is a professor of pediatrics in the Division of Infectious Diseases, and he's the director of the Vaccine Education Center at Children's Hospital in Philadelphia. And he is here today to talk about the status of getting a vaccine for COVID-19 and advice about treating the illness, which could be helpful for those who get COVID-19. Help me welcome to the Lady Charmaine Live Show, Dr. Paul Offit. Welcome to the show.
Thank you, Lady Charmaine.
So how are you doing during this whole shelter in place? Are you sheltering in place, Dr. Offit?
Yeah, I'm sheltering in place here with my wife, my daughter, my son, my daughter's boyfriend, my nephew, and his pregnant wife.
Oh, you
got
have
a whole
full
commune
house.
here.
You got a full house. Well, I know that you have a very interesting, not just story, but you author several books. And one of your books that you author talks about autism, also I believe it says, let me see right here. I have had all the Pandora's Lab and also Deadly Choices. And one that says Autism's False Prophets. So I wanted to kind of talk to you a little bit about that. Plus you also have a new book, but right now we are in this entire coronavirus shelter in place situation. And you work in infectious diseases. So I want to talk to you a little bit more about that. Will we see a vaccine for COVID-19 in the near future?
Yes. Well, it depends how you define near future. But yes, I think we certainly can make a vaccine. I mean, there's every reason to believe we can do that. I mean, human coronavirus has been circulating in this population in the United States at least since the early 1960s. And when you're infected with one strain of human coronavirus, you're going to be protected against that strain for at least a few years. So therefore, you can make a vaccine. It's not easy. I mean, we just got the virus, a few months ago, and we still haven't figured out exactly how we're going to make the vaccine. I mean, are we going to sort of take the virus and kill it, or are we going to weaken it, like with the measles vaccine, or are we going to just take one protein, like with the hepatitis B vaccine? What are we going to do? So we don't even know that yet. And I think that, typically the average length of time it takes to make a vaccine is about 20 to 25 years. The notion that we could make a vaccine within 2 years is remarkable to me. I think it's possible because 40 companies across the globe are trying to make this. There's a lot of money trying to be behind this. Certainly interest and money are not the problem. So I think it's possible we could have a vaccine as early as 2 years, but I can't imagine it would be faster than that.
Okay, here's one of my questions. If a vaccine does come out, should people be skeptical? Because since it's so new, should it be skeptical until we know what the side effects are to this vaccine?
Right, so the vaccine would have to be tested in a large efficacy safety trial. It would have to involve thousands and possibly tens of thousands of people. So you would have those data. I mean, which is true for most vaccines. I mean, most vaccines are tested. I was fortunate enough to be part of a team that invented a vaccine at Children's Hospital of Philadelphia. That vaccine was tested in 70,000 people before licensure. The current human papillomavirus vaccine was tested, the HPV vaccine was tested in 30,000 people before licensure. But you could argue reasonably that's not tens of millions of people. So you can rule out an uncommon side effect, but not a rare side effect. So you really do only know that after licensure. But again, you have to weigh the risks and benefits. I mean, if this virus is still raging, I think, the benefits would largely outweigh the risks. If you knew that it was safe in thousands of people, you would move forward on that vaccine. So it's always the issue. I mean, there are no risk-free choices, just choices to take different risks.
Okay, now we know that we need to wash our hands at least for 20 seconds. If you don't do that, then we need to use a hand sanitizer, at least 70% alcohol, also wear a mask. What are some other things that we can do to stay healthy?
Well, eat well, exercise. I mean, do well by your body. I think, this is a virus, and until there's a clear antiviral that's available, we're not going to have that. But one thing I talk about in the book that sort of surprised me before I wrote it was, fever is good for you. We all make fever. We do it for a reason. Mm-hmm. We do it because our immune system works better at a higher temperature. Regarding COVID-19, if you're infected with that virus, the way your body's going to rid yourself of that virus is that you're going to make antibodies against the virus, and those antibodies are made by B cells. B cells work better at a higher temperature than at a lower temperature. That's why your body makes fever. So So don't treat fever. And certainly there's study after study, and I talk about this in the book, where treating fever can prolong or worsen illnesses. So when the French Minister of Health gets up and says, you should use Tylenol but not ibuprofen, I think the answer to that really is don't use either. Let your body do what it's supposed to do. Let your immune system work as well as it can. That's what fever does.
I learned that in December when my son, he was sick and he had a fever. It was like 8 days and we could not get it to break. And I remember Christmas morning when we had to call the advice nurse and she said, allow the fever to run its course. It's doing its job. And that was the first time. And he is my youngest and my oldest will be 21. And that was the first time I had ever heard anyone say, just let the fever do its job. Do not give him any more ibuprofen. So that was my first time, which was just Christmas 2019.
You have made my day. I am so glad to hear there are people out there saying that. I feel like, that in this chapter, which is treating fever can prolong or worsen illness, I feel like I'm going up against this sort of major cultural sort of desire to treat fever. And it's like you're asking for this seismic shift. But I'm glad to hear there are people like that out there that you've really made my day.
Oh, thank you. And you know what? And it did. We didn't give him any more and it ran its course and it was able to finally break. Now I have another question. Now I'm hearing now that we should not wear masks because masks are now spreading the virus. Is that true?
So I mean, again, you really, so masks, it depends on the mask. Obviously, the so-called N95 respirator is not going to spread the virus. The masks, this sort of rectangular surgical masks that people use, they don't spread the virus, but per se. But I think people can have a false sense of security. I mean, if somebody's mildly ill with this virus and they think, okay, well, I'll wear this surgical mask and that way I won't spread it to anybody else, that's a bad idea. You still can spread it because you can still breathe in and out through the sides of that mask. So that's where you have to be careful.
Now, I want you to tell us about the new book that you have out, because I know you talk about medicines, and there was something in there. Why do you feel modern medicine goes too far?
Well, actually, the first chapter is what we just talked about, which is the fever chapter. But the second chapter, and this was, I guess, what surprised me the most, even as an infectious disease doctor, is you really don't need to finish the antibiotic course. I mean, there are now many studies that have been done showing that you don't need to treat for 7 or 10 or 14 days for your kidney infection or your bladder infection or your skin infection. You can treat much shorter periods of time. You can treat till you're better and then stop. I mean, I don't understand why it is we feel we need to determine a length of therapy at the beginning of illness when we don't do that for anything else. If you have asthma, you treat till your wheezing's gone. If you have pain, you treat till your pain's gone. If you have an ear infection, you're over 2 years of age, and your ear doesn't hurt anymore, you don't have fever, whatever, you can stop. And studies have now shown that you don't need to treat for 10 days for an ear infection. You can treat for 3 days, and now there's advisory bodies that have said exactly that, but still, many clinicians don't follow that advice. It's been hard to watch because we have a lot of antibiotic-resistant bacteria out there, in part because we use antibiotics judiciously, and in this case, because we treat too long.
I've never heard that before because, the doctor always tell you, you need to take this for 7 days. Even if you feel better, make sure you finish the bottle. So now we don't have to finish the bottle if we feel that our symptoms are gone.
So actually, many people do that on their own. As I started writing this book and was getting feedback from people, I found that many people do actually do that. So I think sometimes people's common sense is right. They feel better. If they had a bladder infection, they don't have pain anymore. Their wife doesn't urine. They feel fine. Why am I still taking this antibiotic? And they just save it for next time, which probably is not a good idea. But they stop taking it on their own. When it turns out they're right. We should individualize medicine, personalized medicine. You don't have to set a length of time where we all have to treat for the exact same length of time. And the thing that was wrong is the notion was that if you don't finish the antibiotic course, you're going to create, resistant bacteria. Actually, the opposite is true. The longer you treat, not surprisingly, the more likely bacteria are to become resistant.
Okay. Wow. Okay. Thank you. I'm getting all these revelations today. Well, I want to remind the audience to make sure that you pick up the new book. It's Overkill: When Modern Medicine Goes Too Far by Dr. Paul Offit. It's available today. Thank you so much, Doctor, for coming on the show. It was a pleasure having you.
Thank you, Lady Charmaine.
Have a great day. Bye-bye.
You too.
And be sure to pick up the new book, Overkill: When Modern Medicine Goes Too Far by Dr. Paul Offit.